You never would consider coming out of a game for a concussion.
A hit to the head while playing sports puts some at risk for concussions and brain injury.
We really can't prevent the first concussion. We're trying to prevent the second concussion.
Multiple hits can have a lasting impact on the brain.
I hit the fullback as hard as I could. At that very moment, I went into a coma that lasted 18 days.
We always thought, what's the big deal? It could be much worse than what we thought.
Concussion, a game changer on Southern Remedy.
Southern Remedy is underwritten by a grant from the University of Mississippi Medical Center and viewers like you. Thank you.
I played football since 4th grade on up until sophomore year. I just loved it. I love the teamwork aspect about it. I love the going out on the field with my best friends, you know, doing what we love. I love that it simply taught you life lessons. It was the pure teamwork sport. It was a way for 12 men to come together and work as one working body. And I love the intensity of it. Well, I was playing in a drill that we call Oklahoma, and I hit the fullback playing my position, which was linebacker, and I hit the fullback as hard as I could. But after hitting 8 more times, I stopped and I walked off to the field, and I walked over to a set of dummies, and the whole practice stopped because, like I just said, I didn't come off the field. So all my friends were wondering what's wrong with Wes. I stopped and walked out to the field, and I sat down on the dummy, drank some water, stood up, staggered around for a little bit, threw up, and then I passed out. At that very moment, I went into a coma that lasted 18 days, technically. But to me, it was like that coma lasted 5 months, because literally all I remember from my injury is going to sleep in my bed, waking up in the hospital 5 months later, me having no recollection of the last 5 months or the reason why I'm in the hospital or the reason why my whole right side of my body is shut off.
Mississippi is one of the top 5 states in numbers of brain injuries each year. We really don't know how many we have altogether, though, because a lot of concussions go unreported. So if you include the concussions, which are mostly mild brain injuries, we could have a lot more than we know about.
A concussion is any injury to the brain that is too mild to cause bleed or a bruise on pictures, but significant enough that you have headaches, nausea, vomiting, dizziness, sometimes loss of consciousness, so that we know an insult has occurred, but it's microscopic and not visible.
A concussion is a brain injury. Most of the time it's a mild brain injury. And we really can't prevent the first concussion. We're trying to prevent the second concussion by taking the athlete out of the game.
Let's go!
We passed the Mississippi Youth Concussion Law in 2014 and really started working on it in 2011. So it took about 3 years to get it passed. And what it says is that students that are in 7th through 12th grade who exhibit signs or symptoms of a concussion have to come out of a practice or a game that day and can't go back in that same day until they're seen by a professional. If they're diagnosed with a concussion, then they can't play or practice again until they're symptom-free. The kids that play in municipal leagues in Mississippi are really not covered by the law at all. Some of the individual leagues have policies that they have just put into play themselves. And so the coaches are getting educated online, taking concussion courses from the CDC in different places.
Thank you for teaching me about concussion.
Letting me know that I should tell you if I think I have a concussion. And how to protect my head and brain.
And learning about it, but there's nothing that's actually in place that makes it mandatory. And one thing that we would definitely like to see is that the law gets strengthened and includes kids age 7 to 18.
We had to start somewhere, and somewhere was at the high school settings under the umbrella of Mississippi High School Activities Association, and the MAIS, Mississippi Association of Independent Schools. So we started somewhere. We've got the law. Now it would be to where we all come back together at the table again to see if we can include others as far as our recreational sports to that law.
The protocols with coming off the field, if a concussion is suspected, a player should be removed immediately from play. And the reason is because every player is at some amount of risk for developing what's called second impact syndrome. And second impact syndrome is generally a catastrophic event where there's a metabolic cascade in their brain and it turns into a severe traumatic brain injury at that point. Many times they would die if they were to get a second impact syndrome. So from the highest risk perspective is if a concussion is suspected and if a concussion is diagnosed, you cannot have another impact to your head.
Second impact syndrome isn't common. It should be strongly guarded against. I mean, that's why we're so strict with our return to play precautions. But once you've recovered from a concussion, you don't have the risk of the second impact. You just have a risk of having more trouble if you were to have another concussion. The younger you are, the longer it takes for you to recover from a concussion. The more severe an injury at the earlier age, the longer the long-term consequences, the more severe the long-term consequences are going to be, because you're stopping that brain development and damaging it at a very early period.
The game brings enjoyment to them. It helps them move on, you know, with their day, keeps them out of trouble and different things of that nature. Since I've been coaching, we haven't had many kids that have had a concussion. I think I had one at practice one day. He got up after the play. He kind of looked around, and I could see in his eyes that he really just didn't know where he was. It was doing tackling drill one day, and that usually comes from kids not using the perfect technique when they're out here playing. My number one priority is just making sure that they learn the game, teaching them how to respect each other, as well as other players that they might come in contact with, and making sure that their grades are where they need to be so that if they get it right now, they'll do well for the rest of their life.
I have three grand boys. I don't know if they'll play football. One's 8, one's 4, and one's just a year old. And I tell people all the time, and it may be shocking to them, but I'm not going to encourage them to play football. I wouldn't discourage them, I guess. There's a lot of fear of what we don't know, and what little bit we do know, it's not good. I just feel like it's important that people know as much as they can. The question to every former football player was, how's your knees? And yeah, how's your body holding up? But it's more of the head.
The Golden Eagles steamrolled to an 8-3 regular season record with victories over nationally ranked Alabama, Auburn, and Louisville. The dramatic victory over Auburn in the final regular season contest catapulted USM into everybody's top 25 and landed the team in the All-American Bowl in Birmingham against North Carolina State.
We're not just looking at concussion, we're looking at repetitive head injury.
We want to do everything to mitigate the risk of concussion. But the bottom line is, in any sport, but especially in contact collision sports, there's a risk of concussion. Just like there is a very high risk of concussion in bicycle riding. So what are the things that we should do to help mitigate that risk on the one hand, and that has to do with the rules of engagement in both practice and competition, and the other is, how do we understand this condition so that if it does happen, we manage it properly? And how do we understand that if there is a concussion, there may be no long-term consequences, or if there are, do we really understand those? So those are all the important questions we need to ask.
Concussions will happen, as they always will, not just in football, but they will be treatable, and there won't be severe brain issues later down the road because you've been able to treat the swelling and symptoms that go along with it. So that's going to happen. The question is when.
We want to be both concerned because we understand right now we don't know all there is to know. And given that, we have to work with our colleagues who understand this maybe better than other individuals and come up with consensus documents. And that actually we're seeing happen at the NCAA levels.
Even with protocols, policies, and regulations in place for Mississippi high school sporting events, advocates say more safeguards are needed, especially when it comes to sideline medical care.
Right now, there are 11 schools that employ an athletic trainer. Hattiesburg Public Schools is one of the schools that actually employs 2 athletic trainers on staff to provide for the care of their student athletes. Let's go ahead and slide off the edge of the table here. That's good right there. Go ahead and work your foot forward. Work it back. Some of our school districts in the area and throughout Mississippi have access to an outreach program with a doctor's clinic, physician's clinic, therapy clinic that will send an athletic trainer out to a school for their needs of an athletic trainer to their student athletes. Inside or outside? Okay. Just pushing against that bone a little bit. It's unfortunate that some of our school districts in the state of Mississippi go without any type of athletic trainers or first aid responders, whether that be an ambulance or a fire crew. Not every school has that access to a medical facility close by in their area, and they may go without some type of healthcare provider on site during their activities.
Athletic trainers are the ideal people to be on a sideline. That there's medical doctors sometimes on the sideline. There are sometimes physical therapists, you know, but athletic trainers are trained in first aid and on-field management of injury, including concussion, and that's the identification part of it. And they are qualified and specifically trained to make on-the-field decisions about taking somebody out.
Just tiptoe up. Now, there you go. Get that range of motion going through your ankle joint. As president of the Mississippi Athletic Trainers Association, I feel like we could all come to the table as far as healthcare providers and discuss what ways and means we can come about to provide some type of health care to that smaller school out in the country or rural area, whether it be an ambulance, a first aid respond crew, whether it be the volunteer fire department crew coming in and being there on the sidelines of a game. And you're not only talking about just football, that's just the big collision sport.
As you move up in the ranks, you know, from high school to college and then into semi-professional and professional, the resources go up too. It's an interesting thing that our most cherished resources or our most precious little kids have nothing, you know, protecting them as far as resources and law and policies and procedures and the know of what we need to do. I'm in the know, I know what to do. We don't have that. And then as we move up into our adults who are more able to handle themselves, we have all the resources and all the money in the world to protect them. So we need to do something down here at the lower end too.
Football groups like the NFL and the Ivy League Athletic Association have changed rules to address concussion prevention. A recent study shows that changes in game rules helped some collegiate players prevent concussions. But men playing football aren't the only ones at risk.
Women's soccer, women's basketball, and women's lacrosse that have a rate of concussion that's similar to men's football. So women's soccer at the NCAA level has a higher rate of concussion than men's soccer.
That should be exciting. We've got to have a player that wants to be the best on the field. The second thing we want is a toughness. We want a tough player because in this game, you're going to get hit. Every one of them on the team that's played, they have bruises all over their bodies. And that's because they work hard at the game. And they don't want to lose. They don't want to quit.
A lot of athletes can think that they're okay at first because you might get hit in the head and it might hurt for like a minute, but then you just want to get back on the field and you don't want to be off, you just want to keep going. And so I think that's a big thing with athletes, not wanting to stop.
As soon as there is an injury on the field with the head, they immediately stop the game and we have to go out and get her and bring her out. So they have to be evaluated by our athletic trainer first before they can even go back in or even be considered to go the next day.
I had one last year in our last game of the season. It was in the NCAA tournament. I had jumped up for a header, and the goalie had just she was going for the ball, I was going for the ball. She hit me on the side of the head with her hands, and it knocked me out.
And if the trainer says no, she's done. She's done until she goes through protocol, which is a 5-day system, and once she goes through that and the trainer gives her the okay, we send her to a doctor. The doctor okays her, then she's allowed to get back on the field. When I played in college, even for a couple of years, we didn't have trainers around. I remember getting concussed in practice one day. All the guys were standing over me, and the coach was putting his fingers up going, "Daryl, what do you see?" And all the guys were swirling back and forth around behind him. And it was one of those things, but we didn't have a trainer.
There's not really a lot you can do to prevent getting a concussion. It's just part of the game. You can't not go up for a challenge. You can't not head the ball. You're just expected to do that.
Soccer is a contact sport. You know, you are going to get bumped and pushed around. It's part of the game, but just protect yourself. When you're going in for a tackle or you're just being physical, just pay attention.
In the concussions, you get too many, and some struggle with it. Some are different than others. Some not as much, some do, right? Because we're all made differently. I have sat kids who say, "Coach, I can play." Trainer has said, "Yeah, they can go out, but it'd probably be best for them to sit." I want them to sit because I need them in the long run, not the short term. Anything jumping over is fine, but anything cutting, I'd rather limit her because of her ankle.
You want me to just jump in?
And sometimes you have to step up and just be the man or the lady or the coach, be the adult in charge, really, that says, "You know what? No, your life and your health is more important than this game." Miss Dillon, please. If you're not in trouble, relax, calm down.
There are a lot of gaps in the literature right now regarding concussion. It's pretty widely agreed upon by the experts that concussion in a sporting environment is one of the most difficult sports injuries to deal with. The reason is because concussion is an invisible injury. Really, you're relying on looking for subtle signs and the athlete's report of symptoms in order to even start to think something's wrong. And until you have that, it can be oftentimes hidden.
Concussions right now in an athletic world, and it's sort of vague what's to come with concussions and having concussions and where we're going with this. There's absolutely zero treatment out there for concussions. And really, there's no prevention. You know, you slip and fall on the playground. You go ice skating, you go snow skiing, two kids horse playing in the living room, one hits his head on the table. It's gonna happen, but there is absolutely zero treatment.
So while I'm talking, listen, because this is gonna be pretty quick moving today, all right? Watch it with your eyes.
Researchers around the country are looking into concussion prevention and treatments. One research project is with the Mississippi College men's and women's soccer teams. It focuses on interventions for athletes through physical training.
The intervention is aimed at fine-tuning and improving upon what's known as sensorimotor control. And sensorimotor control, just generally speaking, is your brain's ability to take in sensory information, which is conveyed from your proprioceptors in your joints, so nerve fibers in your joints, from your visual system and from your vestibular system, which is in your inner ear, to put all of that information together in your brain and then direct appropriate motor or movement output. These treatment exercises are all aimed at fine-tuning certain parts of sensorimotor control. So, for example, one of the things that we can train is oculomotor control. And oculomotor control is the precision with which your eyes move. There's a couple primary functions of our eyes. One is that they move smooth pursuit, so that would be like following a flock of seagulls or a flock of geese overhead. The other one is saccades, and saccades is when you move quickly, you dart your eyes from one position to the next. And then another one we use is convergence, and that's the ability to focus your distance far away from you and then focus it very clearly close to you and have that rapid movement between far and near focus. So we can use lots of modalities to do that. We could follow a ball going across a field. We could have you jump your eyes between two different chairs. We could do it on a computer screen and have like a bird fly across the computer screen. And I thought, well, if we can do all of those things, let's do it in virtual reality to train oculomotor control. So the first station has to do with training their eye movements. All right, we're done. The next station here today is another eye movement one, and it's called saccades. And so today we're challenging their balance by standing on an unstable surface, and then we're asking them to read letters and have to move their eyes very precisely around in a pattern. The third station is challenging their kinesthetic awareness in their neck. So we're using cervical, we're trying to get them in a very good posture, and then use their cervical musculature to trace a maze with a laser mounted on their head. So they get that biofeedback with their eyeballs. They can see exactly where that laser is. They're using movement of their neck only to trace this very complex maze pattern. And then they're also on a challenging balance surface, and they have to keep their balance while doing it. We're just going to do that chin retraction and count for 10. So it would be good if you guys did it together. We're working on what's known as neuromotor control, and we're very specifically looking at the activation of their deep cervical neck musculature. These are the muscles, and also flexors and extensors, and these are the muscles that really give us great cervical control of our neck. And the last station also has to do with our neck, and that is we're using a device that actually mounts to your head, and then you're able to strengthen your neck musculature. And the literature is pretty clear that if we can strengthen your neck musculature and give you better control, neuromotor control, we can help decelerate your head and help to lessen the likelihood of a concussion with an impact. We're hoping to show a decrease in the injury rate for the 2018 season comparing backwards to the 2017 season that did not have this intervention. And if we're able to successfully deliver the intervention, honestly, that is a success by itself.
My injury happened on April 30th of 2008. I was 16 years old, and now I'm 26. I never feel like less of a man because of my injury, because of my disabilities. I never feel like less of a man, simply because I know that my injury brought about so much good. I met my wife 4 years ago, had our little girl, my daughter. She's just turned 3. Light of my life. Basically, my life now is taking care of them too, my wife and my daughter. I live for them, I serve them. I mean, the very final stages of getting my disability for that injury. And this has been a hard fact for me to realize, that I just can't do things that I could before. You know, I've had three jobs in the past 4 years that I've all lost due to symptoms of this injury, slowness in my right side.
I've caught a lot of positive support, but also there's been a great deal of negative. Like, hey, you trying to do away with football, or what are you talking about? You know, you were the Iron Man. I'm not trying to do away with football. I'm trying to provide a safe environment, or safer, and that encompasses more than a helmet. I think football is strong enough to survive the worst of storms. It's extremely popular, but I think I say the NFL, because everyone looks up to them, and I think that they need to acknowledge that concussions are a problem and show that they're willing to treat and not just put more pads in the helmet.
The number one message I'd like to get to the parents of the athletes is, if their kids get taken out of the game, let them stay out. Don't try to put them back in. And that happens a lot. The coaches get some pushback from the parents, and just don't do that. You've got to trust the coach and the athletic trainer if they've got one, whatever medical professional is there. And also, we're encouraging the athletes to tell on each other.
I bet we don't understand maybe 10–15% of what the brain is capable of, and how to treat it is the problem. It is such a delicate instrument, and it's such an esoteric philosophical question to understand what seems to make you you, that we are leaps and bounds ahead of where we were 30 years ago, 50 years ago, but I feel like we will be studying the brain and trying to understand the brain infinitely.
If your son wants to play, let him, because it teaches you unforgettable life lessons that you will simply not learn anywhere else. You will simply not learn anywhere else.
I love football. I say I wouldn't trade my career for anything. I gave it everything I possibly could. And I feel like it gave me back what I hoped for, and then some.